So my name is Iyobosa Sonia Omoregie. I am a sixth-year medical student in Kyiv Medical University, and my topic today is acquired vitamin D resistant rickets in patients with human immunodeficiency virus due to tenofovir antiretroviral treatment. So rickets is known as reduced bone mass with calcification disorder causing large amount of unmineralized bone tissue before closure of the epiphysis in adolescence. Rickets can be caused by either vitamin D deficiency or mineralization defects. Our case report is a study of patient A, 12 years old, female, brought into the hospital with severe X deformation of the leg called genome valgum. The X deformation developed during the last 6 months. Patient A was born with human immunodeficiency virus, also known as HIV, and was on a different antiretroviral drug prior and was presenting absent any complication and later changed to tenofovir, which she has been on for the past 2.5 years. So we can see on the left side, patient A on tenofovir treatment. You can see X deformation of the leg, and on the X-ray, we can see expansion of the growing zones. Then on the right, we see patient A before tenofovir treatment. Now, we did our lab results for patient A. Biochemical tests showed us reduced phosphate, alkaline phosphate is increased, and 25-OH vitamin D is suboptimal level, and B cross labs is increased. Urine analysis showed glucosuria and proteinuria. Now, densitometry of patient A was done, and we know that a densitometry of Z-score below -2 indicates low bone density, but our densitometry done on our patient showed severe low bone density. This makes us to suspect, with the above analysis, it makes us to suspect that the patient may have osteomalacia due to tenofovir. Now, our aim and study of this work is to find the connection between tenofovir and the development of vitamin D, calcium, and phosphate disorders leading to severe osteomalacia. Materials and methods of study. We were able to get analysis done with scientific research paper between 2009 and 2019. Literature connecting to osteomalacia. We used our keywords such as vitamin D, tenofovir, antiretroviral drugs, and we're able to narrow it down to about 19 scientific research work we've done with tenofovir of all age group. Now, we want to ask ourselves, what was the reason for this manifestation in this patient? We're wondering what caused a ricket-like formation. But we also know that rickets can only be diagnosed up to 2 to 3 years of age. Now we're going to see HIV. Now on the left side, we have HIV, which enters the cells, unwinds using naturally occurring peptides to form a double helix, and then binds with the host DNA. That is on the left. Now on the right side, we see tenofovir, which is an NRTI. An NRTI is also known as a naturally reverse transcriptase inhibitors, which stops the viral RNA from becoming a DNA by blocking the NRT, which is naturally reoccurring peptides, thereby making the patient in a constant state of non-infectiousness, as we can see on the right side. Now, what is our evidence of osteoporosis in research? The majority of research paper done shows the influence of HIV on patients that have reduced bone mass density, osteoporosis, and the level of vitamin D is also reduced. And this may lead to proximal renal tubulopathies. Now, that is in adults, which we similarly see in our patient A. We can also see from this pie chart, pediatric study showing Fanconi development in, which is also known as proximal renal tubulopathy. We see that about 5% of the patients on tenofovir show Fanconi syndrome. Now, in that 5% that shows Fanconi syndrome, 25% of them have hypophosphatemia, decrease in spine, and total body Z score. Now, what is the influence of tenofovir on vitamin D? Normally, people with HIV are more likely to develop osteoporosis. Also, when taking antiretroviral drugs, increases the risk of osteopathy due to the utilization of vitamin D by tenofovir. Now, what is Fanconi syndrome? Fanconi syndrome is also known as proximal renal tubulopathy. It may be congenital or acquired. Congenitally, it develops at birth. Why acquired is maybe caused by chemotherapy, antiretroviral treatment, or vitamin D deficiency. Now, the main symptoms of Fanconi are proteinuria, glucosuria, acidic pH, deformation of the legs, hypophosphatemia, and syndrome of osteomalacia. Now, we can see this mechanism of development of osteomalacia in patients who take tenofovir. So when a patient takes tenofovir, it goes to the proximal renal tubules and reduces the reabsorption, because we know reabsorption of phosphate, about 70% of the phosphate in the body is reabsorbed in the proximal renal tubular cells. So it reduces the reabsorption of this phosphate, thereby leading to phosphate wasting and glucosuria and proteinuria. Also, this tenofovir decreases the absorption of calcium and phosphate, leading to hypocalcemia and hypophosphatemia, which in case can lead to osteomalacia in patients who take tenofovir. Now, what is our recommendation and our conclusion? In children who take tenofovir, 5% may develop Fanconi syndrome. Before tenofovir treatment, 25-hydroxy vitamin D, calcium and phosphate in blood, and urine analysis should be checked. The child must reach optimal vitamin D before beginning treatment, and then take vitamin D 2,000 international units daily. Every 3 months, biochemical, which is calcium, phosphate, alkaline phosphatase, and urine analysis should be checked. In case of Fanconi syndrome, vitamin D 4,000 international units daily should be given for treatment. Thank you.
So thank you very much. And dear jury and participants, your question.
Hi, Sonia.
Hello.
Is it possible, may I ask you?
Yes, please.
If I'm not mistaken, your patient can continue therapy with tenofovir after adding vitamin D. Yes? Is it recommendation according to literature data?
Yes, it is recommendation according to our literature data, yes.
And you have examined this patient prospectively?
Yes. I and my teacher, we were able to see, although I wasn't there at the first admission, but I was also there when the patient revisited again, and we saw improvement of the deformation of the legs after the treatment was given to the patient, which is the vitamin D.
Yes, thank you.
Thank you for your time.